my PhD in epidemiology at the University of Washington in Seattle. So I am an affiliate associate professor at the University of Washington also. And so I started my career doing infectious diseases in the Amazon, thanks to the Fogarty. I was a fellow at the NIH there. And after doing that, I became pregnant while working on the field. And I think it was then clear that I realized the huge gap in access to healthcare that pregnant women in indigenous, remote, and rural areas in the Amazon face. So basically, they live in extreme poverty. They don't have access to water, electricity, or sanitation. So that is a moment when I changed a little bit my career path as a researcher at Cayetano Heredia. And I decided to apply for funding to Grand Challenges Canada and the Peruvian Council of Science and Technology to build Mamás del Río, or Mothers of the River in English, which is a program that aims to improve maternal and newborn health in remote and rural areas in the Peruvian Amazon. And what we have done with funding from our GCC and Concitec has been to do formative research, implementing a robust intervention and evaluating the intervention. And what is Mamás de Río about? So in Mamás de Río, we train community health workers who are persons from the community, and we empower them with a tablet that has an application that allows them to do home visits to pregnant women and newborns, where they display educational content that have been created with the community. And also they gather health data that the government doesn't have, because 70% of our women deliver in their houses without any trained healthcare provider. So we also, besides training community health workers, we train traditional birth attendants, and we perform community sensitization and training of healthcare providers. So we have evaluated the program. We have several publications, the last one in the Lancet, when we show that this model, Mamás de Río, can improve almost all essential newborn care outcomes. So we are now, so thanks to the success of the program, this was funded. We received additional funding from the Inter-American Development Bank and the Ministry of Foreign Affairs of Peru and Colombia. And our program is also in the border between both countries, operating in Colombia, who faces similar challenges in the Amazon. And what we're working now is toward including Mothers of the River into the national health policy in Peru as well as in Colombia. So that is where we are now. Of course, we have several challenges there, not only maternal and newborn health, but we have a huge rate of violence against women, lack of access to contraception, which is some of the work that we started like a low scale still. And also, of course, we need more cervical cancer prevention, which is a huge need. So there is no cervical cancer prevention at all. Vaccination is super low. So in Peru, we have free access to girls of 5th grade for the HPV vaccine for the quadrivalent, but it doesn't get to rural areas. So that is also a huge need that we have. And by the way, our program received an award, or several awards, but I think one of the most important ones was from the Pan American Health Organization. So we have an award for the Social Innovation Initiative Award. We have a video about the program, and I am happy to share it with you later if you want. It's with subtitles in English. So thank you.